Hi, welcome everyone. My name is Catherine Pei, and I want to welcome you to the first webinar of the semester of our Spring 2021 Family Webinar Series. Ooh, already getting my tongue tied. I'm the director of the First Year Center, and tonight I'm joined by my colleagues and senior leadership from the Division of Student Affairs and across the Washington University community, and they will introduce themselves shortly. We're excited you've chosen to join us for tonight's conversation, so some information before we get started. First, I want to make sure you know how to submit questions during this webinar. So you'll notice that we've given you the ability to ask questions via the Q&A feature. Some of our professional staff within the First Year Center are helping to field these questions. So you'll see several of my colleagues have either First Year Center or Student Affairs and a shield on the screen, and they're the ones helping us on the back end. So in addition to all of the pre-submitted questions that we've received, we will do our best to answer the ones that you submit live during the next hour or so. And we will answer questions that we find applicable to the audience as a whole and respond to more nuanced or personal questions via email later this week. If you are in the Q&A feature, you may also see us dismiss some of the questions. We will ask your question live, but we're using the dismiss function to remove duplicates from the list to help us stay organized on our side. So let's make sure that you know how to use the Q&A feature. And so if you could share the place where you are watching from, and we will name a few of those places on air. And then lastly, this webinar is being recorded, and we will upload this webinar to the families.wustl.edu website later this week. So before passing things along to our panelists, I want to share some of the places that people are joining us from. We have families tuning in from Los Angeles, California, Chicago, Illinois, and New York, New Jersey. So Newark, New Jersey, see, this is already me being tongue-tied again. New York City and Newark, New Jersey, which are not the same place, even though I always fly into Newark to go to New York. Everyone who's from the Northeast right now is laughing at me. That's why Rob's laughing at me. He's a New Yorker. So now I know, since you want to hear more from the panelists, I'm going to ask them to introduce themselves and their roles on campus. And then afterward, Rob Wild and Dr. Cherie LeBlanc and Dean Jen Smith are going to share some opening remarks. So Rob, would you like to begin by introducing yourself?
I would. Thank you, Catherine. I should clarify, I'm a Western New Yorker. I'm from Rochester, New York. Go Buffalo Bills. Great to see everybody tonight. Look forward to talking with you. And my name is Rob Wild. I am currently serving as the Interim Vice Chancellor for Student Affairs.
And he lived in New York City when he was a teacher. Dean Smith, would you like to introduce yourself?
Hi, I'm Jen Smith. I'm the Dean of the College of Arts and Sciences, and I'm here on behalf of the academic divisions.
Kirk.
Hello, everyone. My name is Kirk Dewar. I have the privilege of serving as the Associate Vice Chancellor for Health and Wellbeing and Student Affairs.
Cherie.
Hi, everyone. I'm Dr. Cherie LeBlanc. I'm the Executive Director of Habit Health and Wellness Center and a member of the COVID monitoring team.
And Kawana.
Hello, everyone. My name is Kawana Leggett, and I'm the Interim Dean of Students.
Thank you all. Rob, do you want to share some opening remarks?
Sure, I would. Thank you, Catherine. And I'm going to try to be brief because we know you have a lot of questions, but I thought it'd be helpful to just again start with a welcome back. I know most of you would have received a message from me and Kawana on Friday, as our initial welcome back for the spring semester. We hope that you all, if your students have been home with you, have had a good break with them. It has been a good break for us, giving some of our senior team here, as well as all of our team, the chance to recharge a little bit, regroup, get ready for the spring. We are, as we sit here on January 19th, in full preparation mode. I think we're all ready for the spring semester to begin. I do want to just say to all of you on a personal level, thank you for your partnership. I think we had a very successful fall semester by every measure that we could consider in such a difficult circumstance. And our students really get the credit for this. Our students really were remarkable. We know not all of our students chose to come back, but we had about 80% of our undergraduates here in St. Louis this fall, and we believe it was the right decision. And we also know that for them, oftentimes it was you who were helping support all of the safety measures and the encouragement around behavior that we knew we needed to be successful. So thank you. I do want to say thank you to all of you. I also want to just share a little bit of information about the fall that I know you all know because many of you watch our dashboard. But this is not really a dashboard. This is a Rob Wild screen of data that I keep kind of at my elbow. I kept kind of quietly at my elbow all fall. This is just basically a summary of the cases. It doesn't quite line up exactly with the dashboard, but it's very close. What this shows here are 4 categories of students. It shows students who are quarantining, students who have COVID positive on campus. It shows students who have COVID positive who are isolating off campus, and it shows the students in quarantine both on and off campus. I think this pretty much summarizes our fall semester very well. And I would just highlight a couple of things. Obviously, all of you know that we experienced some stress here with our COVID cases right after Halloween, moving into the Thanksgiving holiday. What's interesting about this data, and I'm sure Dr. LeBlanc will answer questions about this and speak about this, is this, it doesn't really, I would say from our assessment, mirror any kind of letting down of the guard of our students. What this really is a reflection of is the increasing cases of COVID directly in the St. Louis community. This mirrored almost exactly. I also just want to highlight that this represents a very small fraction of our student body. This also includes quarantine students, so it's a little bit misleading. If you look, you never see the isolated students totals get above 100 students at a time in terms of the COVID positive students. When we modeled, we certainly predicted more concerning numbers given what we were seeing nationally, and I think we were, if you recognize the fact that we had over 11,000 students here throughout the fall, this is just a fraction of students that were affected by COVID directly. And I think that really speaks again to the hard work of our students at monitoring compliance. But it's these kinds of data that we are constantly looking at and trying to adapt and adjust our strategy with. I also want to, I wanted to just let you know that we are ready for students to return. This is a photo from about an hour ago. I'm in the Danforth University Center today, and I ran across to the screening tent, where this is the saliva tent where all of our students are screened regularly. And they are, that tent is up and running. We screened we're scheduled to screen just under 700 students today. That number will go down tomorrow and Thursday, and then we will likely screen most of our undergraduates Friday, Saturday, Sunday, and then Monday as we start the new semester. Our system is set up. This is a well-oiled machine over there. The team is ready, and we are excited about the return of our students. And I thought I had one more. Oop, there we go. Just want to mention a few things about the spring semester. And this is one of those where the Zoom environment is hard because I can't see your faces. But this is me looking directly into my camera, looking into all of your eyes and telling you, as a parent myself of 4 children, I have several other colleagues on this call who have children themselves. We consider our students like we consider our own children. We are worried about their health. We are worried about their safety, even when it's not COVID. And I think the COVID environment has heightened our concern for our student community. And we meet regularly. This is a large fraction of our core planning group that you see here today, but we have about 10 to 15 other colleagues who join us regularly. We meet in emergency situations if we need to, and we are constantly discussing and evaluating our plans for safety. And we feel very confident in our ability to be nimble with our plans. And we feel that our plan as we start the the spring semester is sound and is a good plan and is keeping the safety of your students as our highest priority. We learned a lot this fall. We're happy to talk about that during this call this evening. I think, especially when it comes to quarantine and isolation housing, as well as how to do programming and how to encourage safe student behavior. We can talk about that this evening. Student engagement has been a big factor in our planning. We appreciate this has been hard for us because most of us are used to more informal student engagement, being on campus with our students. we've had to find new ways to connect on a regular basis with our students. And as much as you can encourage your students to continue to sharing their ideas, their thoughts, their feedback with us, we all appreciate that very much. And then we are going to talk about a little bit about, I'm sure, field questions about in-person activity for the spring. I just wanted to frame how we're thinking about classes and activities as we start the spring semester moving from the fall. And very little will be changed. We are going to be starting again, keeping health and safety as a priority in what I would consider to be a very restrictive environment, encouraging physical distancing, masking, limiting the number of gatherings where we have people together. We do have some good signs as we start the semester. We are reopening our dining seating on campus following the guidelines of St. Louis County. We are opening the semester with the fitness center open, which was different than how we started the fall. And all of us are extremely hopeful about the news that we're seeing about the rollout of vaccines and what it's going to mean for us as a country, but also as a local community and what we're able to do. And so I know my colleagues are anxious, as we are, to begin to find opportunities once we're safely able to do so, to begin to do more in-person activity as the semester moves forward. But today we don't know what the conditions are, or we know what the conditions are today. We don't know what they're going to be in 2 months. So we're going to continue to be flexible and nimble as we think about the spring semester. So I'm going to stop there because we know you guys have lots of good questions. Thank you very much for being here this evening, and I look forward to answering your questions.
Thank you, Rob. We're going to move now on to our Q&A portion of the evening. And as a reminder, you can submit your questions via the Q&A feature. So Dr. LeBlanc, the first few questions are for you. Lots of questions about our testing strategy as well as about vaccine distribution. So to begin, could you just explain the university's surveillance testing plan for the spring?
Sure, thanks, Catherine. You know, our mitigation strategy really consists of about 11 main principles, and surveillance testing is just one of them. So what I'd like to do is actually take these first few minutes to outline our strategy so everyone is aware of our comprehensive plan, and then I'll address the concerns raised about testing. So the first and most important principle in our strategy, of course, is universal masking. Everyone will wear a mask everywhere on campus unless they're alone in their office or in their single residence room. Physical distancing, everyone will stay at least 6 feet apart at all times from those they do not live with. All of our physical spaces have been designed with this in mind. There are limitations on the number of people allowed to gather both indoors and outdoors for events, and students have been asked to self-quarantine or limit their exposure to only those that they live with at home for the 14 days prior to campus arrival for both fall and spring semester. Everyone is advised to wash their hands frequently. There's enhanced cleaning of all university spaces as well as increased filtration in our ventilation systems. Everyone is also required to monitor their symptoms daily, report any symptoms to student or occupational health, and stay home or in their residence hall until cleared. Free, rapid, and accurate testing is available for all members of our community as soon as any COVID symptom appears. We've added post-exposure testing at day 7 for all contacts of a case midway through the fall semester, and we'll continue this practice during the spring. Positive cases are isolated within 24 hours and a robust contact tracing system is in place, so contacts can be quarantined within 48 hours. Close working relations with our local departments of health, as well as our students self-reporting positive outside testing, allows us to maintain this important time frame for most students, even if they've tested outside our system. Entry testing is required of all students upon arrival for spring semester, as was the case in the fall. Mandatory surveillance testing of all undergraduates taking classes on campus will occur every other week. Consistent policies and procedures are in place to ensure adherence to these principles. There is a daily analysis of data both on campus and in the community by the COVID monitoring team, with regular reports to senior leadership that are used to guide decision making. And lastly, a clear, consistent communication policy is in place, which also involves student ambassadors outlining our action plan. So to address some of the concerns raised about testing, I'll start with discussing the studies that have been done to find an ideal surveillance testing frequency. Our infectious disease experts on the COVID monitoring team have reviewed these studies along with data from our campus and the surrounding community. Their review, first of all, demonstrates that studies have used different reproductive numbers, and that's the number of new cases each infected person will generate to make their recommendations on surveillance frequency. And many of the studies used a reproductive number of 2.5, which is what would happen without any other mitigation efforts, such as masking and physical distancing. So each of these public health measures in our strategy has a proportional impact on reducing this number. Universal masking brings it down by about 30 to 50%, physical distancing another 30% or so, and that leaves testing to reduce the reproduction number by about 10 to 20%, all in the hopes to keeping it at 1 or below as a number. And we felt that this can be done with a 14-day interval. You know, in all expert panels, including the American College Health Association, the National Academies of Science and Engineering Medicine, and Dr. Fauci himself have said that the strategies a university chooses needs to match the needs and circumstances of that particular institution. So the combination of consistent messaging, enforcement, and most importantly, good adherence by our students has kept our reproductive number within a range that more frequent testing would be unlikely to make a significant difference. And at this moment, both on campus and in our community, the reproductive number is less than 1. That said, we monitor the situation not just daily, but constantly, including what is happening in our city, in our state, and on our campus through a variety of means. And we're uniquely privileged in our access to this data because of the role of our infectious disease experts have in mitigating this disease in our local community. These same experts not only contribute to our decision-making, but the regional and national decision-making based on best practices. So, the thing that's most important, I think, for us to think about right at this moment is we need to allow for adaptability and flexibility in the testing plan. It really is critical to accommodate evolving circumstances. So we'll be closely watching the positivity rate of our entry testing that began this past Friday and will be conducted in earnest, as Dr. Wild said, over the next 5 days. If there is early evidence that we need to pivot and change our strategy, we will do so. We have the knowledge, the resources, the infrastructure, and really the unwavering commitment to ramp up or down all of the tools in our toolbox as the situation dictates to ensure the safety of our students, faculty, and staff.
Thank you so much. In addition to lots of questions about our surveillance testing, people are asking about the COVID-19 vaccines. Could you speak to the state of Missouri's plan for distribution and where our faculty, our staff, and our students might fall on that distribution plan?
Sure. You're right. There's actually a national vaccine prioritization framework, and each state determines when vaccination can move from one priority group to the next. And the timing depends on vaccine supply and how quickly each group can be vaccinated. So Missouri is currently in phase 1 of vaccine distribution, and that includes healthcare workers, people on the front lines, and those over the age of 75. We are moving through various phases, and as I said, Missouri currently is in phase 1. Phase 1 has an A and a B and several tiers. It is rather confusing if you start to look at the data on the state's website. But as the state moves through its phases to get to phase 3, which is when most of our students would be vaccinated, and gives us permission to distribute the vaccine, we are making plans to be ready to have a mass vaccination site on campus for our students. We've been told, however, that this is likely to be at least several more months before something like that will happen. We're hopeful it will occur before the end of the spring semester, but control of the vaccine distribution is just not in our hands. Rest assured, though, once we have access to the vaccine for our students, we're ready to immunize them.
And if a student would fall into one of the high-risk categories, where could they maybe find out if they're eligible to receive the vaccine sooner than the regular student population who might not be in a high-risk category?
Yeah, that's a great question too, Catherine. So we're working, currently, the state of Missouri has decided that the distribution of vaccines are going to be done by the major hospital systems. And the one we're most closely aligned with is Barnes-Jewish, of course. And so we're working with them to see how we might be able to register our students who have the specific conditions that would preclude them and put them into a higher risk category. So there's a couple of options at this moment. The state has now allowed people in that category to start to register with them. And as soon as they determine that they will distribute the vaccine to the hospitalists, and that then the hospitalists will then arrange for vaccination. So we have a couple of options. I've put in a couple of queries as well to the folks on the BJC side to see if our students, where exactly they will fall. And I'm waiting to hear their advice. We just had a meeting this morning where all of this started to become more relevant. So we're waiting to find out, but we feel like there are two places at the moment. HABIF is keeping a list of all of our students that we know are at high risk. We're waiting to find out where we can advise them to register. And the thought is at this moment, if they're living in the state of Missouri, the state on their website now has a place to register. And we're waiting to see if we can also work with BJC, though they are still really distributing the vaccine right now in that first tier, which is even above those students under the age of 65 with pre-existing conditions.
Thank you. And one last question for you right now, and I'm sure we're going to have more later. Last semester, our students, if they needed to quarantine, did so for 14 days. And now some guidance says you could reduce that to 10 days. What is WashU's plan for quarantine for this semester?
Yeah, that's a great question too. So we are in the St. Louis County jurisdiction. And while the CDC has made some recommendations that people can consider decreasing the quarantine time to 10 days, we're really under, they've also qualified that it has to be under your local Department of Health jurisdiction. And our local Department of Health, despite our pleas, have said that it is, they are really sticking with a 14-day quarantine, and we must obey that rule. So at the moment, our students, if we are quarantining them, will be quarantined for 14 days.
Thank you. Dean Smith, we have families asking about what the academic experience will look like this spring. Could you speak to that?
Sure. So much along the lines of what Rob Wild was telling you, we're starting out much like the fall. So our fraction of courses that are in person versus fully remote will be about the same across the schools. And we, much like Rob Wild said, we hope to be able to increase, if conditions permit, some of our in-person activities later on in the semester to use our outdoor spaces more extensively. So we did make it to the end of the fall semester, grades are in, and it turns out that the average GPA for fall 2020 was the highest fall GPA in the history of Washington University, and actually up by about 0.15 over the past 5 years running average. So students performed remarkably well academically. And so we feel like, at least from a standpoint of that academic performance, the idea of keeping things largely along the lines we had them in the fall makes a lot of sense. Now we know we heard a lot of concerns about workload. I've talked about those on webinars before. We've certainly made faculty aware of that. That's been a big push in some of the workshops that we've had for faculty in gearing up for the spring. So we're certainly asking faculty to keep track of the workload and make sure they aren't inadvertently adding more than they should be. And then also to really try and enhance the opportunities for connection. I mean, we certainly heard that particularly with some of our asynchronous classes, that students were feeling a little bit disconnected. And so we've absolutely pushed to increase the opportunities for live interaction between students and other students, and between students and their faculty member, particularly for those types of courses.
You know, in the fall, there was an emphasis on how much we'd invested in our classrooms to allow for some small, and in a few cases, larger class gatherings, while also maintaining health and safety. Yet many of our classes remain remote. And could you explain the factors that contribute to why so many of our courses are not in person?
Sure. So the physical distancing that we did in our classrooms knocked down our classroom capacity typically to about 15 to 20% of what it otherwise would be. So, you know, the dominant control on how much we can do in person for the classrooms is that classroom capacity. We also found in the fall that a lot of students preferred the opportunity to participate remotely rather than, particularly as the weather got worse, putting your pants on and walking through the cold rain was just not an attractive option for our students. And so we're also looking at the demand for what students were looking for, and particularly some of those larger classes that we were rotating through in person just did not have the in-person attendance by the end of the semester. So between kind of what we actually saw on the ground in terms of demand and then the capacity that we have for classrooms, those are the major influencing factors in where we ended up.
For our students who have chosen the fully remote option from outside St. Louis, some of them are experiencing kind of great time zone differences. What kind of considerations are available for those students if, you know, maybe they're in Hawaii and that 9 a.m. math class for them is, you know, before the sun peaks over the horizon?
So we do have, I mentioned those asynchronous classes as ones where, you know, we were hearing the desire for more live interaction, but those classes actually work incredibly well for people in different time zones. So all of that information about format is available on course listings, and we're hoping now that students had that information available to them before they registered, that they were able to, from the beginning of their course planning, choose some courses that will work well from wherever they are, whether that's asynchronous or having asynchronous options. The faculty that I talked to were being generally pretty good about making sure that exams were available over 24-hour windows so that students could take them for a time that worked well with them. And many faculty are flexible to make asynchronous options available if that's not the dominant class format. So, I mean, I'd really encourage students to speak directly to their faculty about how they can work with time zone differences.
Thank you. Kawana, I have some residential life questions for you. You know, as Rob mentioned, our students are moving back right now. If a student arrives after their scheduled entry testing, maybe because travel delays, or perhaps even they are so delayed they arrive after entry closes, will they have access to their room for the evening? What does the protocol look like for those students? And then how do they get on the queue to get a test maybe the next day since they missed the one they had scheduled themselves for?
Thanks, Catherine. All residential life students received an email message from the department last week outlining the process of, one, encouraging them to stay within the structured time that were allotted. And so I encourage everyone to ensure that they sign up for those times. We recognize that there may be some travel difficulties that come in place. And so if that were to happen, certainly email the reslife.woostel.edu email address to alert them of your travel difficulties. You will have access to your space, and we ask that you quarantine and self-quarantine, self-isolate within your space for overnight and get tested the next day. You would just need to go and register in the same link and just register yourself, but we would ask for the next day to get tested. It's important during that time where you're self-isolating in your room that you are following all the public health guidelines and only going out for essential items as noted in terms of grabbing and going with food and keeping your mask on. And again, trying to quarantine as much as possible before you get that next day test.
And
I
you
believe
know,
someone's
after, oh, sorry, Kawana, what were you gonna say?
just in the chat box, you'll see the message that went out to residential life students last week.
Great. You know, after Thanksgiving, we told our students that if you've left campus, our expectation is that you stay wherever you went to and don't come back to campus. If a student this semester wants to, you know, go visit family, leave campus, you know, farther than kind of the St. Louis region, are they expected to stay away, or are they able to return to campus?
So I'm assuming that question's for me from a residential life standpoint. We don't have any travel restrictions in place other than what was communicated and Thanksgiving, over the Thanksgiving break. Certainly if conditions change, we will make sure that folks understand the requirements around travel. We just ask that all of our students really consider what is essential travel during this time. And so while we don't have any restrictions, we are asking people to be very thoughtful about their travels during the spring semester. Know that we have been intentional about how we've rearranged the spring semester. We don't have a spring break, and that's for a reason, so that we don't have students traveling all around. And so it's important that if you are making decisions to travel, that you're being mindful about what the conditions are within the area that you're going to, and then also being consistent with our approach to testing. You will need to be in your surveillance testing and not missing your appointments. And if you do find that you have strong desires to travel, making sure that you're talking with our team, especially our habit team, if you have concerns about your exposure levels, and following all the guidelines that we have in place in terms of communicating with habit, health, and wellness.
Then one more question for you. So you've covered that our students can leave, but we're asking them to, you know, closely follow those public health guidelines. Can students have guests come to campus, particularly maybe a family member who was lucky enough to receive the vaccine early on?
So I appreciate Dr. LeBlanc's always sharing good feedback around the vaccine. One of the things that we know that we're all excited about the vaccine, but we don't want people to decrease their level of commitment to our public health guidelines just because vaccines are rolling out. We are going to continue to have all the public health guidelines and all the policies and restrictions on campus in place, regardless if folks are vaccinated or not. And so the residential life guest policy will remain in effect for the spring semester with no guests.
Thank you. Kirk, you know, you talked a lot in the fall about mental health of our students and how it's, you know, just as important for our well-being mentally as it is their academic success. And so Dean Smith mentioned about our students were really academically successful in the fall, impressively so. But what are we doing to ensure that, you know, especially in the winter time, maybe there are less outdoor opportunities, how can our students keep their mental health strong?
Well, thanks, Catherine. We continue to rely on our Habit mental health staff, who've done a really nice job of trying to be able to adapt to this strange environment, and certainly seeing students through HIPAA-secured Zoom for the majority of the individual appointments that they hold is one of the things that we're doing. However, they're also reaching out, as they have been throughout the entire last semester, to other students in other states to be able to do check-ins, to be able to make sure that they're doing as well as they can. Now, we're also doing a number of things through both health promotion and Habit mental health to try and educate students about some of the things that they may be facing during exactly those months that you're talking about. As we get indoors a little bit, and certainly with the change in the weather, it can impact how we're feeling about things. Even with fairly good academic performances, it's sometimes hard to get our spirits up. And quite honestly, I don't know of anybody who isn't sick of dealing with all of this stuff, and including all of those on this call tonight, both in the audience and on the panel. And I think that we continue to be able to do outreach and educational programs to try and help students to be able to recognize where they can find those moments of peace and find those places that be able to rejuvenate their mental health. So the programming continues to come out from those two entities, and we continue to adapt in other ways. And additionally, Habif Mental Health, Habif and Residential Life are looking to be able to make some slight adjustments to the way that we're engaging with students in those environments to be able to make sure that we can do the things that are most conducive to producing good, positive mental outcomes. So we're hopeful that these measures will continue to have the impact that they have been.
Thank you. And then shifting gears a little bit, Kirk, could you review the university's alert level system? Where are we at right now? And what does that mean for those activities on campus?
Certainly. So the university has, in its attempts to be able to make things a little bit more direct and simpler for people to be able to understand, have gone to kind of a color-coded alert level system to be able to make sure people understand where we're at. Now, currently we're at an orange level, which we have been. We briefly dipped down to a yellow last semester and then came back up to kind of an orange level. And those levels kind of give us a brief or a quick glimpse at what kinds of concerns we might have. So orange means we've got a limited activities occurring on campus. We hope to not make it into the red, and we're hoping that as the semester progresses, we can drop down through yellow and probably achieve a green if the vaccine is rolled out and we're doing all the things that we're looking to be able to do somewhere around summertime. The things that is based on that raise or lower the alert level include kind of the transmission rates. And again, what we're starting to see as shown by Rob's graph is a decrease both in the St. Louis area and on our students. Accessibility to testing, which Cherie indicated is doing pretty well right now. The availability of personal protective equipment, again, that's doing well. Contact tracing capabilities. Cherie's team is engaged with a different type of contact tracing right now, and we're hopeful that that can increase our response time and be able to get things get communication with our students earlier than we have been in the past, and also provide kind of a flexible model that we're looking for. And the rate of compliance with public health requirements. So as indicated, one of the things that we have to be thankful for is the deep dedication that our students have done to engage in things that are less convenient for themselves, less comfortable for themselves, for the greater good, and how everything is happening both on and off campus. Other factors that could influence it obviously are how COVID is going, how the shots are impacting it, and the degree to which we might have some temporary or longer immunity from COVID as well. So all of those things play a role in whether the current alert level, as dictated by our COVID monitoring team, raises or lowers in the local area as we respond to it.
Thank you. Dr. LeBlanc, we're seeing some folks asking for some clarifying information about testing and quarantine. So how many students are tested while they're in quarantine to make sure that they are negative. They might receive a negative test result, but then they need to stay for the rest of, till they get to 14 days. Can you just reiterate the county's public health standpoint on that and our responsibility to enforce county public health guidelines?
Sure. So our students, every student who's in quarantine, whether they're quarantining on campus or off campus, will hear from the staff at Habif with a date for what's called a post-exposure test. And we're trying to get that test in the kind of sweet spot for when we expect people who have been exposed and would convert to positive. And that's usually around anywhere between day 5 and day 7. So it's just frustrating for everyone. I so understand this question. So we test, and if it's negative, that's good. However, the potential is that you could still test positive later on in your quarantine, right up to day 14 from the moment or from your last contact with someone that's positive. So a negative, while it's good on an individual basis, we're not suspecting that you have COVID at this moment, does not allow one to leave quarantine, even though that was a suggestion that the CDC was trying to allow, and really the CDC was doing that because so many people are having just a difficult time with quarantine. They absolutely still say the best thing to keep the limit of transmission down is to have a full 14-day quarantine. And because our local St. Louis County Department of Health looked at the CDC guidelines, but still maintain that they will have every resident in the county who has an exposure quarantine for 14 days. And that is our folks as well. Our students are all residents of St. Louis County, as the Danforth campus, of course, is in St. Louis County. If someone turns positive on their day 4 or day 5 to 7 test, we then move them out of quarantine and into isolation, and they are isolated for 10 days afterwards. If a student in quarantine at any point develops symptoms, no matter where that day was in relation to their exposure, they're tested. So people in quarantine are getting calls every day to find out how they're feeling, and if any symptom comes up, we test them then. That's before the day 7. We'll test them again at day 7. Hopefully that's a little bit clearer.
Thank you. A couple of academic questions. If a student maybe decides 2 or 3 weeks into the semester, you know what, I really think a fully remote option is the best for me. So they're in St. Louis now, but they want to go fully remote. Is that an option to switch at a later date if your course modality allows?
So in almost every situation, absolutely, yes. And actually with the caveat that you said, I started thinking before you finished talking, yes, if the course modality allows, and more than 90% of our classes, probably more than 95% of our classes have the remote option for the class. So as long as your course has that, you absolutely can switch to fully remote seamlessly during the course of the semester.
Could you maybe name a couple of the types of classes that are ones that are happening in person?
Only, you mean without the remote?
Yes, like where there's no remote option.
Yeah, so some of the studio art classes and something like the machine shop practicum in engineering, and 1 or 2 of the advanced biology laboratories. In a number of cases, like particularly with the studio art, there are sections that are full. There's a split between fully in person and fully remote sections. And so you likely can switch, but they're at different times. And so there may be a way to work it out. So of course, in Sam Fox, talk to Georgia Bennington, and she will work miracles and make things turn out for you. But yes, in almost every circumstance, you can switch to fully remote.
And Kawana, if someone were living in residential life housing and in 2 weeks realized that being, at home with their family might be a better fit for them, how does that impact a housing contract and a dining contract?
They would need to fill out a housing cancellation, and they can find that at their Washu housing portal. And again, they would be prorated in terms of depending on when they left housing. And so I'd encourage them to review that housing cancellation process, and we work hand in hand with dining services.
Thank you. Okay, Jen, a couple more academic questions. Do we know yet if summer school will be in person or remote? And if not, when might a decision be available, and when would a summer school schedule be available for someone to look at?
So the summer school schedules usually are available in February, so pretty soon. And at this point, I think it's pretty certain that we will have remote options offered through the summer. I think the question really is, will in-person classes be limited to things like labs where we really need that in-person, or will we be able to offer a wider range of hybrid and in-person opportunities? But are you hearing the barking? Is that this? Yeah, I'm sorry. It's Bark Fest time right now. Lots of people walking their dogs. I apologize. So yes, we'll have more details coming up in February. And as always, everything is conditions permitting, but we do expect to have substantial, significant remote opportunities available through our summer school.
Jen, tell Juno and Aspen I said hi. That's actually why I'm in my office, because my dog likes to join in with them. Okay, last question for you, and Juno and Aspen can join in if they want to. Any update on when we might know about the future of study abroad options?
We're in communication about summer right now, anticipating a decision pretty soon. I know we're hearing more, and I know something sounds silly about saying virtual abroad programs, but there are such things. We're hearing more about availability there for programs in the summer. So we will likely have some options that are virtual, but anticipating a decision pretty soon on summer, and of course fall is going to take a little bit longer, but we are playing this out. I mean, we have kept a number of our summer abroad programs live. These are coming up. I think Cherie and Rob may have seen, we're going to talk about this at our COVID leadership team meeting coming up quite soon. So we're getting there. We're still holding out some hope and anticipate a decision in the next week or two.
Great, thank you. Kawana, a couple of co-curricular questions for you. You know, so many, particularly our first year students, so many of them missed out on what are kind of our traditions at WashU in the fall semester. What consideration has been made for those students for fall of 2021? So they came in fall of 2020, but didn't get the true WashU first year experience. What are we doing for them in fall 2021?
Thank you, Catherine. We recognize that this year has been unlike any year that we've had at WashU, and one of the testaments of being a WashU student is your first year at WashU. And so we want to ensure that you understand the First Year Center is committed to offering students an experience right before classes begin in the fall semester. We have done this for every year. We know that for our first year class that came in this year, it looked different because we were mostly virtual, but we're committed to also supporting our current first year students as they return. This will include traditions and engagement opportunities solely for the second year students that had to experience their first year in COVID. The program will also offer these second year students who chose not to live with us their first year to ensure that they feel supported as well. So we are working on ways to welcome back our sophomores and ensure that they have a continued experience that will support their welcoming to the WashU community.
Thank you. And as we look towards this spring semester, could you speak to the spring activities fair, and for our families who are maybe asking about sorority and fraternity involvement as well?
Again, we are very excited that our campus life team has been able to plan really innovative events so that we could partner with our students. It may not all be in person, but we had a fall activities fair that was well attended, and we also will be having a spring activities fair that actually will be taking place Friday, January 29th from 2:30 to 4:30 p.m. And students can go to wugo.worcester.edu to join us and sign up and browse some of the virtual activities during this fair. I also want to encourage our parents that you can opt in into the Campus Life newsletter, and I'll put a link in the chat box. That way you can see all of the events that are taking place and also information around recruitment. I'm going to put a link for our recruitment information for our sororities, and we are going to continue our recruitment efforts to support fraternities and sororities. We obviously know that this will be a virtual space, but another opportunity for students to get engaged. And so I'll put some of the links in the chat box so that you can share with your students.
Sorry, I'm jumping in here. I know I'm messing you up, Catherine, but I wanted to just add something on that I saw this morning or this afternoon that I thought was pretty cool, that your students, you may want to nudge your students about. Our student government called Student Union here sent out an email this afternoon about a student mentoring matching program that really is designed to connect first year students with upperclassmen around their interests. One of the things we've observed in the fall is just how hard it is for those upperclassmen to develop relationships with younger students to help them sort of navigate student groups, fraternities, if that's what they're interested, all those kinds of things. And so ask your student about the matching program, the matching mentoring, student mentoring program that was announced this afternoon by our student government. I think it's a good way in this environment to really begin to build some connections that will be helpful this fall and beyond.
Thanks. And Kawana, one more question to you. Thinking ahead towards the fall again, when will students apply for their housing assignment for next year? What might that process look like? Do we know if we'll be able to bring back our upper division students into the residence halls?
Well, great questions, and we are working on finalizing decisions around the fall, working closely with our COVID monitoring team and others. We hope to be able to communicate this early in February. So again, more information to come as we really want to welcome our students into the premier residential life program in the country. And we know that students have been very patient as we've sorted out this academic year, but we also want to continue to move forward with planning in the fall. Also, we certainly will be in touch in the next few weeks around updates around residential life and housing selection and application processes.
Thank you. Rob, could you maybe speak to our varsity athletes and what's going on with our athletic conference, also the athletic complex, but the conference that we're in?
Yeah, I will cover that briefly. So we have about 550 student athletes among our undergraduates, and this has been a very difficult year. Our conference, our primary conference, football is in a different conference, but our primary conference for other sports called the University Athletic Association just announced last week that it is canceling spring competition. It had already announced fall and winter had been canceled. Our conference, as you may know, is very spread out geographically, and this was largely based on travel decisions and challenges that every school in the conference had related to COVID. We have a plan in place much more quickly to resume athletic practices for all sports should conditions allow it as early as next week. We're a little bit more nimble, I think, than we were able to be in the fall, and so we are going to take that as our first step. We have not, in point of fact, made final decisions about winter sports and definitely not about spring sports yet. We're following a philosophy of trying, for the benefit of our athletes, to delay decisions as long as we have to. And so we are going to continue to work again over the next few weeks to try to make decisions about those sports. We know this is really hard. It is heartbreaking to me personally that we have not been able to see our athletes out in the field in competition, but I remain very confident that 2021 is going to be different than 2020 in terms of our ability to do this, as long as we can continue to make progress in decreasing the number of infections within the community.
And Robert, Kawana, I don't know if you want to speak to what the rec center is starting out to offer, and then if there's any change from the fall.
I'll give Kawana a break because she's been busy, but we are scheduled to reopen on Monday, the 25th for students, and excited about that. We were not able to do that to start the fall semester, and so this has been a good thing for us, I think, to be able to reopen activity there. It is continuing to be students are going to have to register. The cardio equipment is not open yet, but again, we're going to continue to focus on being able to make changes during the course of the spring semester as conditions allow, and I remain optimistic. But the Summers Rec Center will open on Monday.
Cherie, this is for you. And I know we've talked about this in the past, but I think there's some people on the call who weren't with us in the fall. For our students who live off campus or they're, not living residential life housing, what does quarantine and isolation care look like for those individuals?
So there's two options. If you're a student who's off campus, is able to quarantine or isolate safely, they can stay where they are. And that determination is really made by HABIF, with looking particularly at having one's own bedroom and bathroom. What doesn't change, whether someone's on campus or off, is the care that they receive from HABIF and our contact tracers. Everyone in isolation will have either a Zoom meeting with our nurses, a phone call from our nurses, or whatever is the student and nurse prerogative or preference, on a regular, usually daily basis, to be sure that they're doing all right. And if they're having any symptoms, we will then decide whether to bring them into HABIF and see what they need, or if their symptoms were such that we thought they needed to be sent to the emergency room, and our infectious disease colleagues would be there to look after them. In quarantine, it's the same. Honestly, if people are able to safely do that in their own residence, they can. And again, HABIF's contact tracers will still call them every day, watching for symptoms. They will still get tested. We will give them transportation to the testing site. And if a student wishes to come on campus for whatever reason, even if it's deemed that they could do this safely, that is certainly an option for them. And we have moved students who are off campus and could do this safely, but they just felt like it was too much hassle to try and figure out their food or whatever it was, and they really wanted to come onto campus, and we certainly accommodated that as well.
And I don't know if Sharif, this is a question for you or Kawana, but for students who are in quarantine or isolation, are they able to receive packages or deliveries, or is it really as self-contained as it sounds?
So we've worked very hard with our campus partners and reviewing student feedback to make some updates for our spring quarantine and isolation housing. For the fall semester, we did have a more restrictive approach to ensure that one, we could best support our students and ensure that we were supporting the outside community too, but we are expanding some of our services to include mail and working with our quarantine and isolation teams on delivery, and also to look at what it means to get delivery of food. We've worked very hard with our dining services to provide food, but we also know that there have been requests for some deliveries, and so we're working to finalize that and hope to roll that out in the next week or so.
Bob, I know you and the provost provided an update about commencement, but is there anything else that you can share with this group about the timeline for decision making and what might be happening?
Yeah, the headline from that communication remains the same. Our goal is to host in-person commencement for both the class of 2020 and 2021 in the second half of May. We are working towards that goal. Our next update on that will be before February 26th, but we are continuing to make plans for an in-person commencement. There likely will be some changes if we're able to do it in terms of guests and conditions that people have to satisfy before coming to campus. But we know that's one of, if not our most important tradition for our campus and for our families, and we are working towards that.
Kawana, can you give an update about indoor dining at Washu? I know at the end of last semester we had to close that per county order. Are we able to have people eating inside as we open for the spring?
Dining Services is approaching this as wanting to welcome our students back into the dining facilities. We are opening it up at a reduced capacity, but there will be some dining options taking place inside. But again, we're not going to the full open operations, and there's a link in the chat box to look at some of the announcement for Dining Services, but we will have limited indoor dining, but I'm excited that hopefully as the next couple of weeks go, we'll be able to open that up even more.
Okay, and Rob, I'm giving you the last question, and it's not COVID related. You know, what resources are the university providing to help our students process and cope with the political unrest that's occurred in the United States recently? And as we look towards the presidential inauguration tomorrow, how has the university prepared to support our students?
Yeah, thanks for that question. And this is a very dire moment for our country, as everybody is following. January 6th was a very difficult day for us, I think made more difficult because we couldn't be together as a community to process and discuss everything that we were seeing. I am happy to say this is our bread and butter as a university. I mean, this is what we are set up to do with students. We have an outstanding faculty here. I would highlight my colleague in the law school, Professor Greg McGarrian, who's been very active in discussing what's going on in the country right now. He's a constitutional lawyer who specializes in freedom of expression. And I would just say, encourage your students to get involved with our faculty and find, even if they're not taking courses on this, but if this is something they're interested in, we have faculty who have studied this. For those who were able to attend last night's Martin Luther King commemoration that was moderated by Professor Lerone Martin, you know, there was a lot of discussion about what January 6th meant for our country and what it means for the future of our country. And we want our students to educate themselves and be engaged in those discussions. We also know that they want support. You can see on our Center for Diversity and Inclusion website examples of programs that we've done in the past around the November election to support students, creating smaller affinity virtual spaces. Again, it's more difficult to do this, but I'm proud that we were able to do this fall. You know, the other really good resource for action for students who are interested in taking action both here in the campus community, in the St. Louis community, and the national community is the Gephardt Institute for Civic and Community Engagement, which I glanced at their website today, and they are already geared up and ready for students to return. For students who want to get engaged in projects related to the political climate, again, to further educate themselves. But, you know, a university, I mean, these are sad days for our country, so I don't want to minimize this, but in some ways, I want to just highlight how important it is to be able to be at a university during these times where you have a lot of people who want to tackle these discussions and discuss all sides of the crisis that we're facing and how we move forward as a country. And so certainly you should be nudging your students to take advantage of the environment they find themselves in at this moment in our collective history.
Thank you, Rob. So panelists, thank you all for joining us tonight and sharing this important information about the university's plans for the spring semester. Families, we hope that you are able to get some of your questions answered. You'll be able to find a recording of this webinar at families.wustl.edu beginning next week. And if you have additional questions we weren't able to answer, please email us at families@wustl.edu and we'll get back to you as soon as we can. So thank you so much and we'll see you soon.